hospital, and we have had a very good meeting with our staff. And I want to reiterate, as you can see here, we have members of the union, that we have had a very good meeting checking on our hospital operations to make sure that Nairobians continue to receive the quality of services. The county attorney, we have the chief officer in charge of health, and my name is Veska Kangogo, the CEC member, acting chief, executive for health. Now, before we continue, I would like to state that there are many issues that have been raised from the reports of deaths that have occurred in the hospital, but I want to say largely that the deaths have occurred from the operations that are normal to health. You know that this is a referral maternity hospital, and we want to just give a clear report about the status and the conditions under which those deaths occurred and how we have managed it so far. The other thing I want to highlight is that there is an inquiry that is going on, which is a multi-agency inquiry. We have a DCI taking care of the investigations. We also have our own internal systems of finding out exactly what could have happened. We have the medical board also. We have representatives also from the national government, the Ministry of Health, and that report should be out shortly so that we settle out the challenges that could have occurred and going forward to ensure that we have amicably resorted to measures that are going to make sure that Nairobians get the best service. So with me, I want first of all to give an opportunity to the Chief Officer Health, Mahat Jimale, to give the exact report on the deaths.
Good afternoon, ladies and gentlemen. First and foremost, most welcome to Pumwani Hospital, the biggest maternity referral hospital in East and Central Africa. First of all, you have to know Pumwani is purely a maternity hospital. Secondly, Pumwani Hospital, just like NH, is a referral hospital for mothers who are pregnant from across Kenya. And when I'm saying Kenya, precisely also in Nairobi, we have low socioeconomic settings, the urban slums, which form 60% of the Kenyan population, Nairobi population. I wanted to demystify some myths that Pumwani Hospital has a number of unaccounted bodies or stillbirths that are not from the hospital, according to the media. The truth of the fact is that out of the 11 bodies that were confirmed yesterday, we can entirely account for each and every child with the tagging and notification of deaths. So clear account of the summary is, out of the 11 deaths that happened between Wednesday to 11th and 17th of September, that is how many days? 6 days. We had 244 deliveries and 11 deaths. And I want to account for the 11 deaths. Out of the 11 deaths, fresh stillbirths, which we say fetus with no signs of life, weighing less than 1,000 kgs, were 1,000 grams, were 4. Fresh stillbirths were 4, and out of the 4, the main reason or the reasons for their death is no heart rate on arrival for 2, and 1 we had advanced labor breech delivery obstruction, and similarly for the 4th one. So those 4 can be accounted for, and the complications and the support given by our top ops guys is available with us. Number 2, out of the 11, 2 were macerated stillbirths, and these 2 stillbirths were weighing 2.2 kg and 3.5 kg respectively. So the main reason for the macerated stillbirth are to do with protracted labor and antepartum hemorrhage. The other 4 were basically neonatal deaths. And out of the 4, the causes were purely number 1, birth asphyxia, number 2, referrals from health centers like Mukuru, where the kids scored badly on ABGA, and 32 weeks with a child weighing less than 1.7 kgs, and then another child weighing who was 32 weeks, also weighing 1.6 kg, and by the time the child was brought, came with respiratory distress and sepsis. And the last one, I've said 11, I've accounted for 10, was a child who was brought in dead by a Kenyan, so that Pumwani Hospital can safely dispose the child. Complications that arose, and it's very common, and I've said this is a referral hospital, the kind of mothers we get come with a lot of complications. Of common, obstructed labor, sepsis. We have mothers who come with eclampsia or preeclampsia, mothers who come with ruptured uterus, mothers who come with severe sepsis, or obstructed labor, final stage, let's say the 3rd stage, delayed. So the mitigation measures and interventions that are ongoing is we have maternal and neonatal mortality survey done every week. At the Nyayo House, where the headquarters for the department is, we have a review committee that sits once every month. Number 2, at the level of the hospital, headed by the in charge of Ops guy, they have a weekly review meeting for neonatal deaths and 48-hour review meeting for maternal deaths. So, in addition, and I'm sure a number of times I've talked about this in a number of forums, one of the interventions which is coming up probably in the next 3 to 5 months is putting up critical care units in this hospital. And specifically, the neonatal ICU and maternal ICU. The space has been provided. Some of the equipment are with us, but we want to have, let's say, a minimum 10-bed ICU for neonatal because of the number of deliveries we are dealing with. And you very well know you cannot compare Pumwani with any other facility in East Africa because we are entirely dealing with maternal cases. And we are dealing with newborns and a number of referrals. So establishment of neonatal ICU and maternal ICU is critical to reducing this mortality rate because you are getting extremely complicated cases. I think I don't want to exhaust a number of issues I wanted to discuss because operational issues will be tackled by our minister. Let me give 1 minute to wacha tumalize. Yeah. Let me give 1 minute to my able pediatrician, who is the acting med sup, to give a brief review or overview of the interventions we've put in Pumwani as a center for excellence in terms of maternity services. Dr. Karibu.
So thank you, Bona CEC, Madam CEC and Chief Officer, and thank you all who have come to be with us this afternoon. Yes, indeed, we have put measures to mitigate against some of these complications. As he has said, we had quite a large number of mothers, and most of them actually do come late, and they come with complications. So when they arrive here, they are actually received by skilled workforce. Our midwives, they are trained in what we call emergency obstetric and neonatal care, which we keep reviewing on quarterly basis to ensure that they are well skilled. We have also taught them on basic neonatal resuscitation, in as much as we are waiting for advanced measures like what our Chief Officer has alluded to. So with this training, we have done enough capacity building of our staff. Apart from that, we have other low-cost, high-impact interventions we have put in place. You've already been told that 2 of our babies that we lost were because of prematurity. So one of the key interventions we've been carrying out is what we call Kangaroo mother care, whereby we utilize the mother to offer the warmth to the baby. And this has really changed the narrative of our statistics here. We have managed even to reduce their time period, hospital stay period, from initially 2 weeks to the current 1 week. The other intervention we've done to take care of our neonates is supporting them respiratory-wise. We are using a mode we call Cpap respiratory intervention, whereby even without ICU or advanced airway support, you can be able to support these children using basic equipment to help them, stabilize their breathing activity. The other thing we have done, as I'm sure you've read in the news, we are in the process of initiating a human milk bank, which will actually be a first for the Republic. And that will go a long way in actually ensuring that our small babies who are vulnerable get enough nutrition.
You have talked about people or rather mothers who come here to deliver, who receive great workforce and skilled people, personnel.
Yes.
What's the ratio of the patients to the doctors?
Okay. Currently we have 5 gynecologists, and we have 12 medical officers and 3 clinical officers. Of course, that's not an ideal number, but we are making do with it. And every mother who comes actually gets attended to by a midwife and a doctor, a qualified doctor.
What about the number of wards? How many do we have? And currently, we have been told you only have 6 nurses and supposed to be 10. Talk about that kindly, the capacity per shift.
In total, let me put it this way. We have a total of 160 nurses, and they are distributed within the various working stations. We have some in labor ward, maternity theater, and newborn unit. While they are there, they distribute themselves shift-wise. So we will find that where we expect the shift we expect to have more load, like the long day shift, we have more nurses. So actually they do go up to 10 on good day, but some days, yes, we agree, we have a short of about 2, so we get 2 to 6 nurses a shift. But at this juncture, I'd also want to bring into attention, we have a school of midwifery, so we are also utilizing the students who we are mentoring to actually help us with the workload that we are handling. Sorry?
How many like on
But
a normal day?
on a normal day,
Yes, how many deliveries?
60 to 80. And sometimes it used to go to 100, but because now the county has also capacity built our neighboring health centers, our numbers have slightly gone down, but we do up to 80.
I have a question for each of you, if you don't mind.
Yeah.
So, as the head of lectures now, could any of these deaths have been prevented if the hospital was better equipped? For you, having explained all the 11 deaths, are you now saying that none of these deaths were suspicious, as the governor said yesterday, and therefore the suspended officials did nothing wrong? And for you, how does a hospital like Pumwani not happen? Like Pumwani not happen?
I think the 3 can be handled by 1 person. No, 0.
Okay. Okay, thank you very much. Let's also first of all agree that mungeniletea stool. Okay, this way. Okay. Okay, so let's agree on one thing. The county government is currently undertaking reforms in all the service delivery sectors, and one of it is in health. Why you saw the governor here yesterday is because he was answering to a distress call from one of the patients, and a husband who was reporting about the wife. He has adopted an open door policy, and he responds to issues of the public in the ways that he thinks is the best way to deal with it. And he found it wise to have an impromptu visit, which is also one of the best styles that one can use when you want to find out what is going on in an institution. One of the things that we have to also accept is that as you have been told, this is a purely maternity hospital. We serve so many people from informal settlements. The kind of population that we receive here, we deliver between 60 to 100 mothers per day. The other issue that you've asked is whether we have a morgue or not. This facility does not have a morgue, but it has a cool storage or room where the conditions can hold bodies for a short period of time. And this is an arrangement that has been on for a very long time. And as we budget in the coming financial year, we have agreed that we will have a cooling facility in this Pumwani hospital that is going to make sure that the preservation of bodies will be on time. Otherwise, we have bodies collected from this hospital every Monday, Wednesday and Friday and taken to City Mortuary. Initially, it used to be done on a daily basis, but we work towards at least making sure that we have 100% safe deliveries.
Why is this then? Why is it? Kwa nini mbona ukapatikana huko kwa store? Boxes.
And then we call it in bags. Then the governor actually surprised because this is not the first time. The first time bodies are stored in boxes. What options are you giving to the county government? You talked about holding, but if at all this was really there, why were these things stored in boxes?
So I want to point out that we have a designated room, and that is where the bodies were found. And we have to make do with the resources that we have to make sure that we package the bodies in a way that they can be transported for suitable storage and disposal in the City Mortuary.
So
Just one question which you did not answer. Could any of these deaths have been prevented if the hospital, as you say, was better equipped?
Now, one thing that we have to agree, none of those deaths occurred out of lack of emergency services.
So
because as you have heard, they could have been better operational efficiency if some of the doctors that were on call could be reached on time. But from the reports that we have received, the doctor was available, and none of those deaths occurred out of circumstances which could not be managed within the hospital. As you have seen, 4 of them were stillbirths. That means the babies were already lifeless by the time they were being delivered.
So that means what's the status of these suspended officials? They are innocent. Yes.
So on the other issues of staffing and communication from the county, I'm going to give the county secretary to give you the status of the investigations, and I want to promise Nairobians and Kenyans at large that immediately we get the report from the multi-agency, we will comply with the recommendations that will come out of the reports. Because one thing that we have to agree is that let's give also an opportunity for institutions to carry out their mandate. But we cannot sit as management and not act. We must take action, but we also must exercise fair practices that are going to also bring back the confidence of service delivery in Nairobi. So I want to give I want to give the CS. Now, the total budget for the healthcare sector for this financial year is 6.7 billion. This includes capital. Remember that we came into place 1 year ago, and there was no adequate financing of our facilities. We really want to thank the health committee of the county for allowing us now to expeditiously ensure that we have resources that can be deployed to our facilities. As you have all known, we are now expanding the facility at Mama Lucy. The 72-bed capacity is almost complete, and I'm going to welcome you. It is open. You can go and see. The roofing is on. ICU is expected to be operational in the next close to now 80 days. And we expect that such even emergencies that can be gotten from this facility can be taken care of in other county referral hospitals.